Welcome back. I am here now with Meg Schrader. She is the breast navigator for Augusta Health Oncology.
Yes.
Tell people what you do.
Thank you for having me. What I do is I work with women and men and their families, either when they're in the process of being diagnosed or once they've been diagnosed with breast cancer. I help to navigate them through the system and just kind of provide support and a familiar face for them as they go through the different phases of their treatment and into survivorship.
And my understanding is that that role was created because breast cancer in particular can be complicated to navigate through.
Absolutely. There are so many decision points. You know, years ago it was very cut and dried, and now we really are into personalized medicine. So it really depends on the woman's choice as to whether lumpectomy followed by radiation or mastectomy, and there's so many different decision points, and we give women and men an awful lot of information, and what I help to do is kind of sort that out a little bit, reinforce what the physicians and the providers have said to them, and just kind of support them through that, because there are so many, thankfully, there are very, very many decisions that we can make now because we're catching it earlier, so we have more treatment options.
Well, and that's really what we want to talk about today is mammography. Probably nobody is in a better position to explain why women should get an annual mammogram.
Mammography is one part of kind of a three-legged stool. Women need to have their mammograms. They also need to have a breast exam, a clinical breast exam by a provider. And there's been a lot of discussion over the past couple of years about, do you do self-breast exams monthly or not? We're a firm believer of you need to know the landscape of your breasts. You know, most women are not really great about doing a monthly self-breast exam, but they know when something's different. And that is sometimes what prompts them to go to their providers, but it really is three-pronged. It's not just the mammogram itself. Mammography is the best we have right now, but it does have some limitations, and that's why you really need to follow up with your provider to make sure you get that clinical breast exam as well.
Tell us how digital mammography has made a difference.
Digital mammography has been wonderful, especially for women that are premenopausal or perimenopausal in that wonderful, when we're trying to figure out what we're doing, and the breast density changes. So the nice thing about it is it's like our digital camera. The radiologists they can magnify the images, they can zoom in on things, they can change the contrast, make it darker or make it lighter. So it really helps them to be able to really look at women that have dense breasts and to help with that. It's kind of like when you think about density, you think about a snowflake, and when it's falling, it's fine and you can see it, but once it hits the snow, you really can't. And that's sometimes the way women's breasts look like on mammograms. So that's the really cool thing about digital, is it allows them to do that. And what we've seen is with some is that we don't need to do as many repeat views or callback views because they can actually see things a little bit better when they do the screening mammograms.
Very good. Augusta Health in 2010 received a very special accreditation. Tell us what that accreditation is and what it means to patients.
In 2010, we were certified by the American College of Surgeons, and we did receive our designation from the National Association for Prepared Breast Centers and Professional Breast Centers, and we're very excited about that. It truly was an organizational effort. All of our surgeons, our plastic surgeon, our pathologists, our radiologists, everyone came together, our oncologists, medical and radiation oncologists, and we worked on it for about 18 months. And it really is, there are 17 standards, there are 26 components, and they look at everything. They look at our quality measures. We actually exceed a lot of the state and national benchmarks, and we're very, very proud of that. But what it means to women in the community is that you get top flight, state-of-the-art care right in our community. You don't have to travel someplace else. You can be very, very confident that you're in great hands at Augusta. And the other thing is we have a multidisciplinary breast conference where we actually present women's cases before they start treatment. So, and in that conference we have radiation oncologists, medical oncologists, we have the surgeons, we have gynecologists, we have pathologists, we have all of those radiologists, all those folks in there to really look at what are the national guidelines and what's the best care for that particular patient based on on the pathology and the biology of her particular tumor. So that really is very powerful. And when I talk to women and say, we presented your case at Multidisciplinary Breast, they know that they're being very, very well cared for. And I think that's the most powerful message, is you can stay in your local area and be treated by a team of specialists that really, really are passionate about breast care.
Awesome. Last question, quickly. Where can I get it done?
You can get it done at Women's Imaging at the hospital at the main campus of Augusta Health, and our new outpatient center on Statler Boulevard. It's the old Blockbuster building. Convenient parking and just great.
Cool. Thanks so much, Meg. And when we come back, we are going to be talking about smiles.
Your Health Matters, brought to you by Augusta Health.
My name is Sandy, and in the fall of 2009, I was diagnosed with breast cancer. I met Meg during my second biopsy. She's the breast navigator for Augusta Health. It's huge to have someone not only guiding the course of your care and helping you make informed decisions about your treatment, but someone who understands what you're going through and understands what you're feeling.
Augusta Health, nationally recognized quality, community-focused care.